Hello, everyone. I'm Brad Heineck, and I'm not just hanging around upside down. We are going to tell you and explain clearly how inversion tables work for back pain as well as sciatica. And we're going to help you decide if you should actually buy one and get it to your house as well.
Yes, we are.
What do you say, Bob?
Yes, we are.
Well, let's go to work.
Bob and Brad, the two most famous physical therapists on the internet.
All right, Bob. This is how I explain this to patients and other people. The inversion table acts like traction. In other words, the weight of your torso from here up is hanging upside down and pulls on your lumbar spine. And let's show this model.
It's like decompression.
Exactly what it is.
So if I'm applying the force here.
So you're like gravity.
Right.
And this is tipped up like I was at the beginning of the video.
Right.
And
I'm pulling.
Yep. So what's happening is things are getting pulled apart here. And here's the injured disc with the herniation right there is the model. And when I'm pulling, now let's look closely, zoom into there, and we've got a model for this. Hold on.
See what happens.
Now, here it is. This is, let's show that, Bob, once. This we're going to pretend is L5. So we're looking at this
Right there.
vertebra. And here's L4. Okay, these are vertebra cups. And now this red ball represents the disc.
It's the same color.
Yeah, it is. And it's a wonderful thing. Now, what happens is here is the disc and the vertebra. Now, here, the spinal cord actually goes right through here. Imagine that. And then there's these peripheral.
roots.
The nerve roots come out here. Okay. Now, what happens when you have a herniated or bulging disc, you can see it's bulging there. Now, with the traction that we demonstrated that occurs with the inversion table, the two vertebrae pull apart, and as a result, look what happens to that bulge.
It's like it vacuums it up.
Yep, it brings it in. That pulling apart, decompression, brings that back in. So,
Good demonstration.
yeah, it was kind of fun, eh?
Hey,
Yeah, to our neighbors in the UP up there, in the Upper Peninsula. So what we want to do is when you're on the inversion table and you're back like I was at the beginning, that traction occurs and you want to continue that not more than 1 minute or 2 minutes the first time on there. Okay, we're going to have another video coming out with some specific details how to set this
how
up.
to do it.
Exactly. 10 steps specifically.
the details.
Exactly. I also want to cover some precautions.
Right.
In other words, some reasons that you may not be appropriate to use one of these.
Right.
If you're a normal, a healthy person, chances are good. But a couple examples. If you have blood pressure problems,
Right.
you may be able to use one, but you need to talk to your physician
Your
first
doctor.
and get that cleared.
Heart disease.
Heart disease, yep,
Right.
anything with that. If you've got eye problems,
Right.
like
It
glaucoma.
increases the pressure on your eyes. So
Exactly.
you want to do that.
Yep. So get that cleared with your doctor. If you have a hernia, you know,
Right.
that can change things, and we want to make sure we're safe there. There's actually a whole list of other precautions. If you go to, we represent
The teeter.
Teeter because we
Right.
like them. They're well built,
Yeah.
and you can go on there or on any other
Teeter.com.
teeter.com. I can't
so-
remember.
yeah,
I think
okay.
so, but if
Well,
you
Google it.
yeah. If you go inversion table precautions, you'll get a list of them.
Sure.
The best thing to do is ask your doctor. But if you're a healthy person, you've had no surgeries, no hardware in your back, you're probably able to work with these.
It'd be nice if you could try one before you bought one.
And that's a good point. Again, we do, because of these teeters are so well built, this is why we cover these. I used one that wasn't a teeter, and it
Right.
worked fine.
Right.
These are just built well. It's, for example, the FDA registered. They're UL certified. If you don't know what UL mean, that's Underwriters Laboratory. And if they stamp it, you know the quality is
Right.
good. It's safe. Now, the interesting thing, when you're looking at these, this has a smooth plastic support or backrest, which you might think it's better if it's cushioned. But you don't want it cushioned. You want it smooth so that when
You can slide.
Exactly. You want your body to slide without resistance. So that's another thing to look for. This does have a lumbar support that you can remove and put in and adjust it. I don't have it here.
You don't like it either.
I don't like it
Right.
for myself, but you may like it. And some may or may not have that. It's not a big deal. It's just a little benefit, if you will.
Right.
Traction handles.
Where are they?
Well, on this one, this model of teeter doesn't actually have them, but you could use these. And that's when you're inverted all the way back or to 60 degrees like we are here. You put your hands on them and you push a little bit just to
sure.
get a little manual traction
Otherwise,
with your
you
arms.
just use your body weight, right?
Right. Typically it's body weight, but that just gives you a little tweak. It's not a big deal. And then make sure they're easily adjustable, which the
This
teeter
works
is.
well, yeah.
Again, if you don't have to buy a teeter. If you want to know you're going to get a good one, you will, and other ones that are out there.
You get what you pay for.
Pretty much,
Right.
yeah, exactly. So,
Less than life.
and Bob, you just mentioned. I did want to mention. Should you buy one? Some people say,
Right.
I got back pain. I'm going to spend a few $100s on one of these. Is it going to work, or is it just going to be something you can throw your clothes on?
Right.
So I'm going
Laundry catcher.
Exactly. So the best way to know if these are going to work is to try one.
Yes.
Which presents a little bit of a problem, particularly if you don't have one available.
Right.
If you have a friend or whatever that has one, go over to their house. Make sure you know how to set it up for yourself. Again, we've got a video on that, and try it. And if you get good results, yeah, you should buy one.
Yeah.
If you don't have that option, I know Teeter for a fact gives you 60 days.
To assess it.
Yeah, to assess it. If you don't like it, you can mail it back to them. They'll give you your money back in full. You have to do it within the time period. The other thing about it is, I believe, make sure you keep the box.
Right.
If you threw the box away, you can contact them. They'll give you a box that it fits in. I do believe the shipping is not covered to get it back to them.
Gotcha.
I'm not 100% sure on that, but I believe that's the case.
By the way, Brad, I want to mention that they have videos too on this. Right?
Teeter does. Yeah,
right.
Teeter does a great job. As a matter of fact, Roger Teeter, the inventor,
He passed
just
away.
passed away
Right.
in January of this year.
January, right.
I believe it's his daughter, Riley. I don't know for sure. I believe it's his daughter. She does a lot of videos.
Could be daughter-in-law.
Well, it could be. I don't know. But she does a really good job of instruction on their products. So good company. You can't go wrong. Okay. And that wraps it up for this. Again, we do have one video out. We're going to put another one out with 10 steps how to properly and safely use one of these. It's going to be a to-the-point video and work out well. So, Bob, what do you say?
I believe you're getting taller, Brad.
Oh, well, yeah, that is a thing with this. We should do a study on how much you actually grow.
If only it would make you smart, too.
Well, that's beyond. That's
pleasant.
That's a concept that
Or
is
better looking.
Yeah, well, all those
All
things
right,
are just
all right.
not going to happen.
All right, thanks.
Take care. Oh.